Kornberg. I grew up in Melbourne, Australia. I attended the University of Melbourne for veterinary science. I finished my degree, it was 2010. From there I went over to Queensland Veterinary Specialists, a multi-specialty practice in Brisbane, Australia, where I did my rotating internship. Following that, I went over to Mississippi State University for my neurology and neurosurgery residency. After completing my 3 years there, I passed my board exams and then found myself down in sunny Florida. So I have a family background in neurology. My dad is a pediatric neurologist in Australia. So when I was studying at veterinary school, I'd go actually to work with him in the mornings because the Children's Hospital was actually across the road from University of Melbourne. So I'd do all my studying there in the mornings before school, and I'd take part in medical rounds with the neurologists there. So I got a nice little insight into neurology. I was wondering how it would apply to animals. At the time, in Australia, veterinary neurology wasn't really well known. There was like 2 neurologists in all of Australia at the time. And whenever we'd see a neurologic case, it was always a different specialty having to handle that case. So it was something that definitely piqued my interest, and it's a rapidly evolving, cutting-edge area of veterinary medicine. The dog that I saw was Max, who was a 10-year-old mixed breed dog with sudden onset of seizures. He had an MRI scan and he had a choroid plexus, what we thought was a choroid plexus carcinoma. He went and had radiation therapy and responded very well. After this, about 2 months later, he started having really bad seizures, and he presented in status epilepticus, which is a seizure that you can't stop. So we got the seizure under control, and then we re-imaged, and we found that the tumor was actually blocking the cerebrospinal fluid from actually leaving the brain and causing what's called an obstructive hydrocephalus. That was acute. And at this point he was blind as well, and severely affected. So we did an emergency ventricular peritoneal shunt surgery, where we place a tube between the brain and the abdomen with a valve in the middle to drain the fluid continuously and provide another path for the fluid to leave the brain and prevent further pressure from building up. So we placed the shunt and continued with the radiation therapy, and he ended up doing really well. He went back to having a good quality of life, remained seizure-free, even regained some vision as time went on. And then we re-imaged his brain about a year later, and the tumor was significantly shrunk, and he ended up having a good long quality of life after the surgery, even though it was a real long shot to have a good outcome here. The most rewarding thing is meeting new patients and clients, and being able to fix and help patients that otherwise wouldn't be able to have a chance. I find that really rewarding. I also find it's also rewarding is that I've been doing this since 2012, so that's 11 years, and I'm still learning new things every day and new ways to do things, and also things that I previously thought wouldn't be something that I would be able to fix or help. We're finding new ways to be able to do that, and I find that's really rewarding. I think a lot of it comes down to the communication. I think it's really important for us to communicate why we do these diagnostics and what the diagnostics are actually for and how it can help the pet in the long term. A lot of the time there's a misconception that when pet parents come to us, we're going to recommend imaging no matter what, and that's not always the case. Sometimes imaging isn't warranted, and if we're going to undergo anesthesia for something that's not going to find us the answer, then doing the anesthesia isn't in what's best interest for the patient, so we won't recommend it at that time. But it's really important for us and part of our job to put people at ease and explain why we want to do these things and how we can help once we do them. And that's why that's really the best way to make people feel a lot more comfortable in coming to see us and taking on our recommendations. I think SEVN there's a few things that SEVN does really well, better than other places that I've been at, and one of the things they that's really works in our favor, is that we are a single specialty hospital. So our whole hospital is set up for the care specifically of neurologic patients. And I think that's really awesome because we don't have to worry about our staff having to fill other needs within the hospital, because all the staff are here for the same need, which is to help patients with neurologic conditions. Everyone's specifically trained in this area to deal with the patients that we get. We see a lot more cases than most places do when we perform at a very high level, and that's something that anyone who comes and works here can see from the get-go. So what it's done is it's cultivated a culture of really strong patient care and care for the people who bring the patients as well. And ultimately it's reflected in the fact that we generally have very good outcomes. Yeah, I've got a lot of pets of my own. I've got 3 dogs. So we've got Monty, who's a 10-year-old mixed breed shepherd. I have Freddie, who's a 12-year-old rough collie. I have Kimber, who's a almost 2-year-old rough collie. I have Thomas, who's a probably about 10-year-old or 11-year-old domestic short hair cat, an orange cat. And I've got Deacon and Drover, who are both horses, and they live at home with us. Yeah, obviously I've got a lot of pets at home, so we spend a lot of our free time with them. A lot of the time, I try to ride the horses at least once or twice a week, or at least train with them. I also am a runner, so I like running and racing, and I also play Australian football, which is similar to rugby. There's actually a team that's based out of Fort Lauderdale, and we play against other cities' teams around the States, and we have a national competition.